Spiritual distress is a real thing at end of life. It's a very common type of thing we talk about as far as, end of life workers and clinicians and colleagues. Not so much necessarily a topic of normal conversation in other parts of life outside of this field. So I'm going to talk about that today and what it means and how it can impact people at end of life. Hi, my name is Abigail. I'm here to normalize these conversations and education about death and dying so we die better at end of life. Let's get into it today. So spiritual distress, this is something that we talk about, as end of life care providers is a normal topic of discussion, actually. I think even when I was working my 15 years of hospice and palliative care, I think we thankfully got more and more aware of it and began to really pay more and more attention to it as the years went on with each coming year. So why do I bring this up and what does it have to do with it? Well, I just want to remind everybody, and this is outside of just the the dogmatic type of stuff. I want to just remind everybody that there is a component of us that is something more than just physical. Yes, we're physical beings, but we're also mental, we're also emotional. And yes, again, depending on your belief system, there is a spiritual component. I strongly believe there is because I saw evidence of it in my work that it's just impossible for me to deny. And I also have my own experiences with it. But regardless of that, we're more than just physical, right? We have this emotional body to us, this mental body to us, and that impacts every other aspect of our health and of our lives. So I speak about spiritual distress kind of in that context as I'm kind of lumping things together. I know that they're different, but they're also kind of a little bit related, however you want to look at it. But I just want to bring this into the picture because at end of life, especially when I've seen cases where people, without any good explanation, without any good clinical explanation, they are hanging on and they haven't died. When they haven't eaten in days, weeks, sometimes they haven't had any hydration, they've stopped, going to the bathroom, and they're as thin as can be, or maybe not so much, but still there's just no other physical explanation to explain why they're hanging on. I've just seen it so many times where people, this resilience of the human spirit, human nature is so interesting that I have seen people really decide when they want to go. And when people are, for lack of a better term, hung up on something, meaning they need some other thing, some other resolution, they're in some level of distress that's outside of the physical. So I'm terming it as spiritual distress. Maybe it's emotional, maybe it's mental, maybe it's past trauma, whatever it may be. There's some type of continued distress that hasn't been resolved. And why does this matter? It matters because in order for a person sometimes to die, they need some kind of resolution. And I've talked about this in previous posts and videos and stuff, but this is for me to remind you that, again, to not forget that there is this component to us that is something we may not be able to, see and touch and feel, but that's other than, it's a non-physical type of portion and component to us. We absolutely need to pay attention to it and its well-being, because at end of life, it's going to be very hard for somebody who is in distress, spiritually, mentally, emotionally, whatever it is, to die, and to die the way they want to die, and to die peacefully, if this is not resolved. And it can also look like things like having terminal agitation, having this level of agitation that, someone's unconscious, but they're having this agitation level where they keep trying to move around, get out of bed, and they can't get comfortable. And you're doing all the medications, you're doing everything you can, but again, have we addressed the full aspect of this person, all of its components, not just the physical ones? And have we addressed them to the degree that this is going to help this person to ultimately have a peaceful and more comfortable death? And that's the question to ask. So what does this mean for you? It means, first of all, if you are alive and you're well, or even if you're not even close to your death, even for days, whatever, I need you to pay attention to these non-physical aspects of yourself. Okay? And does it mean you're going to get all the healing that you need right away? No, not necessarily, but pay attention, and if you can, do the best you can to get the assistance that you need to heal from whatever, or to get some resolution from whatever, whether it's forgiveness from a certain person that you need. Maybe it's just forgiving yourself for, living like you lived, in terms of maybe being super career focused and not paying attention to your family members. Maybe you're having a strange relationship with somebody. Maybe you have a history of some traumatic events and you are still holding on to that, and there's still something there to process. Maybe it's maybe it's some other pain or loss that you felt. Whatever it may be, it can be so many different types for so many different things for so many different people. Please do whatever you can to first address that and try to do as much healing as you can with that. Secondly, if you or your loved one is not there, use your hospice team, and hopefully again that you're on hospice, to work with you on a resolution, even when a person is not conscious. The hospice team, hospice chaplain or spiritual care counselor is the appropriate term, or medical social worker, in addition with working with a nurse and other clinical members of the team, holistic providers, nursing aides, all that, so the physicians, they all work together. And even if the person is not conscious, I want to make that clear, if the person can't respond, they can work with them. They can talk to them in a certain way that is really therapeutic, that is specific to either their religious or spiritual practices. If they didn't have one, speak to them in a way that can talk through a type of forgiveness or a type of resolution. Worst case scenario, sometimes we just don't know. But what you need to do is, even when someone is suffering an end of life, they're not letting go, they're living beyond what is, what we can physically explain, and or maybe they are agitated or not, treat them physically, do all the things that we need to do, but also don't forget this non-physical component of themselves, and assume that there's something that they're holding on to. And, whatever it is, work with them on the forgiveness, work with them on finding some kind of resolution, even if it's not the perfect thing, finding a way to find some peace. And again, the people who are the experts at this are the spiritual care counselors in hospice, and also the medical social workers to a degree. It depends on, again, the scope and the breadth of each and every one, because there's some people that have a little bit more training in certain other fields than others. And so I don't want to just speak for everybody. The nurses I've seen do amazing things. The nursing aides I've seen do amazing things. So all of these, what's important is that you don't die without hospice. That's the other big thing. So that you have the right professionals working with you. Some people want to bring in their community imam or the rabbi, whatever it is, fine. Do that, do whatever is going to be perfect for and suitable for the person who is dying. So again, just a reminder that we have to make sure that we treat this other component of ourselves, not just the physical stuff, when we're at end of life and dying, in order to assure a really peaceful, comfortable death. Let me know if you have questions. Let me know if you have any other things or thoughts on this. I'd love to hear your thoughts. I always really appreciate you stopping by and listening. My name's Abigail. I'm here to normalize these conversations and education about death and dying, so we die better at end of life. We all deserve that. I will talk to you soon.